you, detect, how do you care, how do you support, and how do you also prevent, this disease? And therefore that crystallizes into 3 areas of activity. The first one is the health response. So what are the activities from a health response perspective that we can catalyze? And we can talk about that as to what some of those have been as a fund to help gap fill and to also help in ensuring that, our front line was protected, because that was the first phase. And I can talk through some of the decisions that we are making and we're making today. The second pillar has been in the humanitarian response. So if people, are going to get ill, or if we've had lockdown, for example, as we've had, over 60 odd days until this past Monday, what are some of the humanitarian issues that arises out of that? Certainly we saw food security being a critical a humanitarian issue, that arose in terms of families that are vulnerable, becoming even more vulnerable because of the lack of economic activity. Things like gender-based violence, spiking and so forth. So the humanitarian effort is quite an important area of activity for us. And then thirdly, is an area where sometimes it may not be visible as we would like it to be, but certainly very important, which is around this whole notion of solidarity as in a campaign, as in unity in actions, as in how we collectively educate one another about the behaviors, that we need to embody. That will help us in flattening the curve, right? I mean, we talk a lot about washing hands, wearing masks, social distancing. Those are quite important fundamentals that we need to keep rooted, because if we do those well, and this is why for me, I think that I really like this behavioral change kind of aspect of the campaign, because if we do that well, then it creates less of an impact on the health system. And then your humanitarian response, is not as severe. Exactly. So it has a cascade effect across everything. And I think certainly with the cues that we saw, and I saw a figure today saying that South Africans spent more than 250 million rand on alcohol on Monday. That behavioral change, aspect becomes critically important if we are going to really make a dent on the pandemic. So I've taken the scenic route in explaining what the fund does, but I hope that helps in crystallizing the context.
No, it does, Nomkita. Thank you very much. Look, you guys have done a great job. If you look at your website, you've received 2.6 billion already, with a pledge amount of almost 3 billion, 2.92. And obviously the goal is 4 billion. You've done great work. We have seen the impact. And as I said earlier, I am definitely one of the people that have sacrificed some of her salary increases and board fees to make sure. And I think, as you said earlier, some the ladies that you work with that have been part and parcel of our organization make it easy for you to even say, look, because you are all there, let's see how we can support. Because I know that the work that you're doing there is you're not getting paid for it, and we're so used as AWCA to be a labor of love job activities like that you don't get paid for, but have a huge impact in society. So absolutely. I think the Solidarity Fund is definitely doing a great job, and thank you so much for just that overview. And I know that a lot of people will understand why this organization was started in the first place, because I'm sure every organization or every business or every individual in South Africa would have wanted to contribute, but this is more of an effort that is being taken by everybody in South Africa, and we say big ups to you for working so hard to ensure that the mandate is achieved.
Thank you, Muzi.
Thanks, Nomkita. All right, my second question was going to be around the pillars, but you have touched on them, and I think you covered it very well. I want to be able to give people an opportunity to ask questions later as well. So my next question was going to be around, so with all the support that you received from all these pledges, and I did specify the amounts that I'm seeing now on the website, which is live every 48 hours. Based on the demand for the support that you guys have seen, especially around the healthcare response and also the SMME support, what more do you think we can do besides just contributing? I know you said some companies are providing in-kind support. And I think I was listening to one of your interviews previously when I was preparing for today, where I know that even banks were providing you guys with accounts and they're not charging fees. So if there's anything that you feel there's a gap, is there a gap that you think as South Africans can still fill over and above what is currently being provided to the Solidarity Fund?
Okay. So, there's one thing that's quite clear, and it becomes crystallized, especially in times of crisis, right? That the need is vast. Yeah. And that execution is absolutely critical. Execution is everything. And so I think that because we've been set up, as an independent fund, we've been able to act a little bit faster than perhaps, let's say, organs of state and departments and so forth. But clearly the numbers that you have quoted as being on our website are very, very minuscule in the context of, they're not minuscule in terms of the people's contributions, but I'm talking about the relativity of the need. It becomes a drop in the ocean in a sense. And we can never compete with what is, let's say, the government budget of 1.9 trillion, for example. Yeah. But certainly in the work that we do, we try to make a difference where we can. And maybe let me speak about some of those areas, and then maybe then it can become a little bit clearer to colleagues on the webinar as well as to where are some of the areas of support could be. So the first point that I just want to say is that at the time when the Solidarity Fund was announced, I think that there were other various initiatives that were also announced. If you remember, the Rupert family, announced a billion, and also, but that was targeted mostly at helping small businesses. So that sits outside of our fund. And oftentimes, a lot of the questions that we get is, what support do we have for a small business? So we're not a funding organization, as it were. You would look at us as a relief organization, as a relief effort organization. So we don't fund businesses. There's the government, a small business fund that has also been created to help businesses that obviously will buckle under the severe pressure of a constrained economic environment. So that mandate falls outside of our fund. In terms of the activities and the work that we have done so far, as I mentioned in the health response, a big part of our resources, have gone into the health response. So if we look at those numbers that you've quoted, I would say with some of even the decisions that we're kind of making today, we would have spent close to, or spend by the time the cycle of what we have and everything executed, close to 2 billion in the health response. And the first phase of that started with ensuring that we are providing support to the protection of the front line, our nurses, right, and caregivers, who are most exposed because they have to be caring for the ones that are ill and falling sick. So there was a lot of effort to bring in personal protective equipment into the country. In addition to financial services working in the fund, I'm learning a lot about healthcare and the healthcare industry. And one of the things that is quite interesting is that before the pandemic hit us, 92% of all of our medical equipment that we use in this country is actually bought globally. Only 8% is manufactured locally. And at the start of the pandemic, we probably had less than 2% of personal protective equipment that we had in the country. And so we spent the first, when we say first phase, say first month of the pandemic, acquiring a lot of that PPE. And by ourselves as the fund, I think we've been instrumental in the purchasing of just over 35 million units of personal protective equipment. That may be in the form of gloves, masks, and so forth, that gowns, boots, aprons, that is needed. And that has been dispersed to hospitals across the country. And also some of that PPE has been dispersed to community healthcare workers who work outside of the public health or formal health system, because there's a lot of people who provide support to communities, especially in the rural areas. So, and now what we're starting to do is we're starting to pivot to, as we enter this next phase of the pandemic, where obviously when you look at the television and you look at the minister announcing numbers, they are spiking, every day. But that's a function of two things. More testing is being done, which is good. So you have to conduct, testing for you to be able to understand what it is that you're dealing with. But what that means is that you are also going to have a larger pool and universe of people that are likely going to fall ill, who are then going to need either ICU beds, for example, capacity. So that's one of the areas where we're starting to branch into now beyond PPE. How do we support the availability of ICU beds in our provinces, especially our most acute hotspots, and I think we know what those are from what we see in the press, and also catalyzing the local manufacturing sector. As I mentioned, 8% of the medical equipment that we use in the country is being manufactured globally. So we basically import everything. And one of the challenges that we saw in the procurement of the PPE is that, given that this is a global pandemic, we are all scrambling for the same resources, right? So there's a limitation in terms of supply, and also that influences the prices, that you pay as well. And so what we sought to do as a fund is to also catalyze more longer term innovation and solutions that are actually going to be homegrown, which will stand us in good stead. So we've funded the prototype production of ventilators, for example, non-invasive ventilators. So you talk about what are the opportunities, where should professionals, where should, our colleagues in AWCA. I think if we can crowdsource ideas around where are those areas that perhaps, even in this pandemic, we can say we are creating new industries. We are also trying to create, jobs. We're losing jobs, but hopefully let's try and create, some jobs in new industries that we have not had before. How are we repurposing some of, the capabilities that we have? For example, some businesses, because they were closed down in lockdown, they started repurposing, if they were making, let's call it shirts, then they started repurposing those to making medical gowns, for example. So it's all of those things, I think, that are going to make a difference. So it's really about innovation, I think. And also where I see the need, we've had lots of people that have put up their hands to say, how can we help the fund? So certainly intellectual capacity has been an important aspect of what we've needed as a fund, and we are glad that we've co-opted onto our audit risk committee, for example, 3 of your members in AWCA. I'm not sure if Trifosa has shared that, but 3 of your members are joining our audit risk committee, and I think that they bring valuable skills that also help stress test some of the processes that we have and the controls, because it's quite important for us to be absolutely 100% accountable for each rand and cent, that has been donated by South Africans. So that's one way of helping. But I also think that another way of helping is, if we kind of amplify our voices in a way, right, in terms of the areas that we see are areas of need in our country. As I've said, I think we can never have enough voices that speak to this behavioral change that needs to happen. If we think that this virus, as the experts tell us, is going to be with us for a very long time, at least the next 18 months to 3 years even. That's what Prof. Salim Karim tells us in terms of, so we can't be cocooned, you know, because otherwise we'll stagnate, as we've seen already, the debilitating impacts on the economy. So we have to amplify. So AWCA needs to be a powerful voice in influencing, you know, changes in behaviors, you know, in some shape or form in the platforms where you are at. And I think your first virtual meeting is also one of the powerful ways, you know, that you are demonstrating that. That's quite important because first and foremost, we need to keep people safe as much as we can. And secondly, I think there's a lot of work that needs to be done in saying, how do we make the things that we do sustainable? So certainly as a fund, this is one question that I always challenge us around, is that even though we're a rapid response and maybe our life cycle is not going to be there forever, because we're not meant to be a forever kind of fund. We're here for, you know, this intervention. But how are some of the things that we are thinking about, or the areas of activity, how are they catalyzing more sustainable, ways of doing things? So, for example, a lot of your membership base works in financial services and so on, right? So how many of your members have looked at this activation of local manufacturing? Who's funding that, right? What are the funding models? The fund could certainly act as an offtake kind of, you know, partner, because we are procuring. So how are we in our daily jobs, you know, looking at how we can make a difference? And that's what I mean about the amplification, you know, of our voices. It's not just about the charity or the relief of what we're doing, but using this as a beachhead to really create different ways of doing things. Yeah.
Thanks, Nomkita. That is a very good and comprehensive response, because it touched on a lot of my questions around how do we support some of our members who are entrepreneurs as well. And I think you've touched on how we've used some of the existing local manufacturing sectors. For one, I know at the IDC where I work, is that the textile industry obviously has been suffering in the last few years. So I think definitely there's opportunity for people to be more innovative around working towards resuscitating that industry. I always used to say, whenever I would go to a client that's in the textile industry, I would say, I'm from Mthatha, and one of my aunts, or maybe everybody around us, had an aunt that was working at Tuwa.
Yeah.
Itua, which is Butterworth, for those that don't know. Itua used to be the textile hub of textile industry hub of South Africa's. And when you drive past Itua, those factories are now sitting there, they're empty. So people definitely need to be more innovative on how to resuscitate some of the industries that were really, really key in our economy in South Africa. So thank you for that, Nomkita. And I think there was a Bujani also asked how Black entrepreneurs can be given an opportunity, and I think you've answered that very well. And I saw that Sisoto was also saying congratulations, umama wethu naye loyo. Congratulations. Is it? Oh, that's why you said congratulations, Zukulan. Yes. So no, thanks for that, Nomkita. And then I've got Vimbai, who's saying, thanks, Nomkita, for the work you're doing. Don't you feel that more of the fund should be allocated towards humanitarian efforts rather than health interventions, which the government should be covering?
That's a very good question, if I may answer. I saw that, and thank you for that question, Vimbai. So I think one of the things that we are very clear about is that the life cycle of this pandemic is going to last, you know, for quite some time, as I've mentioned. You know, Prof. Karim, who, as you know, is the key advisor in this space to our government, has certainly affirmed that. So it's something that will be with us for at least 18 months to even 3 years. And in that life cycle, there's going to be different phases, right, that are going to require different interventions. So certainly, Vimbai, I think that in the first phase, what was needed. It's like if you are preparing for any war, like you first have to fortify your fortresses, and your fortresses in this instance is the healthcare system, because if that buckles, then we are in trouble. Then the consequences are more dire. So, which is why I stress that this thing will always look at it in phases. And certainly, our resources don't replace what a government should be covering in any means, but I think they've been able to catalyze and give them a little bit of room in some instances and a buffer, right? That they can be able to clean the support. And this has not only been from the fund, by the way, but there's other big foundations and organizations like NASPAVs, for example. They actually also sourced PPE worth about R1 billion, for example, that they've donated to the country, and foundations like the Motsepe Foundation as well have done the same. And in a lot of instances, we've kind of partnered to maximize and achieve scale. So that has been the first phase. And so clearly, the humanitarian phase has also been inherent in that first phase. So we spent about 120 million rands, for example, over the past month or two in providing food support to vulnerable families in the form of food parcels. And whilst that was an important intervention, but we have to talk about the fact that it's a thing that can't be affordable in terms of perpetuating. So we have to pivot towards more sustainable means of how do we help South Africans to be able to produce their own food, for example. How do we partner with traditional leaders and other leaders in society and other formations to create, almost go back to basics. These are things, when I grew up, these are things that we used to do. People used to, plant and grow their own food and so on and so forth. And so those are some of the things that we are pivoting towards. So how do we support communities, and also how do we partner with traditional leaders, for example, who have the oversight of large tracts of land, especially in the rural areas, that if you were to cultivate and be productive, you could actually support and feed more than 17 million people, for example, versus spending 120 million rand once off. Yes, you reach 300,000 families, but 2 to 4 weeks later, you're going to have to do that again, and then you're going to have to do that again and again. So the humanitarian efforts are quite important in that regard. And as I mentioned, one of the areas where we've seen a significant spike in the humanitarian space, Avimbai, is sadly something that affects us as ladies and women here on this webinar, is the spike in gender-based violence. It really has been real. And so our ability to be able to work with organizations that can provide, places of shelter for those women and also children, because in most instances, it's not just the woman that's affected, but it's also children, has been an important area where we have worked. So in humanitarian, I suppose it's more complex because the needs are so different and vast. And so you always have to have a hybrid in terms of your approaches and solutions.
All right, thanks, Nomkita. When you talk about sustainability, it triggers a very serious issue for the AWCA, because we understand that the education industry obviously was affected as a result of COVID-19. And as you know, that our core reason why we even exist as the AWCA was to ensure that people from rural areas, previously disadvantaged communities, have an opportunity to go and study and become CAs. So one of the things that we wanted to obviously touch on was around the education industry and what the Solidarity Fund is doing. And as the AWCA, that's definitely one of the key areas that we would want to see and also show our support, is to ensure even our sustainability as an organization. Any points there, Nomkita?
And that's a very important factor, because I mean, as a mom also to two kids who have been home for 2 months and doing online schooling, certainly it's been quite clear the advantages that the haves potentially have to the disadvantages of those who don't have the same access, for example, to data, to all of those various tools. Exactly. And in some of the things, our efforts are not necessarily going to be about how we disperse money, but about how do we crowdfund a solution. So, for example, we've partnered with some of the MNOs, the network operators, in terms of encouraging them. As you've seen, a lot of them have zero-rated data costs, for example. And that's been part of our, let's call it, influencing and collaboration effort with them, so that you can make that accessible, especially for learning for our kids at school. Yeah. In terms of, what have we funded in education in particular, one of the topics that's on the table at the moment is that it's exactly that. And it's about to say, as we see the schools reopening, how can we help? And obviously with the resources that we have, because remember, we can't replace the Department of Education. We can't replace, the department that deals, the higher education department. We can only leverage the resources that we have. And one of the areas where we think that we can play a role in particular is focusing on those schools that are special needs, schools, in terms of supporting them with provision of PPE, for example, and so forth. Certainly in our food drive that we embarked upon, a big part of that was in trying to also replace the feeding schemes at schools that were closed during the period of lockdown. So a lot of the beneficiaries around that were, families with children that were participating in those feeding schemes. And one of the areas where we are trying to, again, in the protection space, if you look again at our pillars, so you would say that our interventions around the protection space is that we are also earmarking to deploying some of the PPEs that we have acquired to medical schools. We've got 7 big medical schools in the country, and we're actually working with them, especially as the 5th years return back to university, to say, how do we support them with protection, because they are exposed, and also remember, they start doing their practicals in hospitals as well and so forth, so they need to have an allocation of PPE. So I would say in the education space, we've leveraged the core competence of the things that we have, but to deploy it, into the education space per se. So unlike AWCA, that I know, funds, bursaries for people to study and so on, that is more long kind of a term nature and investment. And so as a fund, our longevity and life cycle is not going to be that long, to see somebody going through from wherever you start funding them to them qualifying, for example. But certainly we can come together and put some innovative ideas in place that help with the immediate. So I think it goes back to the nature of our fund, which is, the rapid and catalytic point around it. But I think one of the things that we can't do, we can't close off what potentially could be good long-term sustainable ideas. So to the extent that AWCA and its members, have some thoughts as to how the fund can be specific within its mandate in terms of how we could broader support, the education of our kids and fellow brothers and sisters, then I'm sure we would welcome those thoughts from AWCA members. Yeah.
No, thanks, Nomkita. And, even simple things like giving access to students, give them access to data, computers, and things like that. Those are in my mind, are quick wins before we can talk about the long-term ones, which I will definitely be knocking on your door when you get your trillion fund, ithethe into izokwenzeka, law of attraction. So
Okay.
trillions definitely yes, and for the long-term ones. But for the short-term ones, I think there's definitely something that we can put together and we can chat to you about.
Yeah.
You are giving access to data and laptops.
Yeah.
All right, I can see, thanks Nomkita. I can see Pakama, congratulations, Monso. Okay, so she's more talking about the humanitarian part of it, being a mother, and given the activation of our economy, I cannot help but shudder at the compliance levels of creches and nurseries and what needs to be done to support families.
Mm.
And then I've got Sisodwa. I see great opportunities in the health sector as you spoke about the PPE. I hope that the Minister of Trade in your board, this pandemic can be reused as a catalyst for making South Africa the exporter, at least for the continent and other countries. That's a very valid point, Sisodwa.
Yeah, very valid point.
Yeah.
And yeah, as I say, one of the big things that we're making decisions on is firstly the manufacturing of tens of thousands of our own ventilators, but certainly given that, you know, the prototypes would have been proven, I think, as I said, it catalyzes a completely new space for us as South Africans. Yeah.
Yeah, and then Sisindi, hi Sisindi, our founding member. Nomnye umama wethu nalona sinomkitha. And hi Nomkita, thanks for gracing us with your presence and your thought leadership. One of the challenges we're seeing is the lack of support for entrepreneurship, in particular Black business, in the provision of the supplies procured by the Solidarity Fund. There's almost a narrative building that because of a crisis, BEE is not a priority anymore. Oh, that's not good. Inequality has been heightened at this time in many ways. How do we ensure we do not widen the inequality gap that is felt at this stage? That's a very
Yeah.
good question, Cindy.
That's a very good question, Cindy. Thank you. And also very topical in terms of the discussions actually that I've been having over the past 2 days. So firstly, I think it's important to correct something that may have been incorrectly perceived or communicated as being attributed to the fund. So as I mentioned, the fund is a rapid response vehicle. And so for us, in being able to ensure that we are able to account and stretch each cent and rand that has been donated, there's key guidelines, especially because this relates in the procurement of PPE in particular, that have guided us. Firstly, price, that's quite important. The quality of your product. I mean, I don't know if you saw in Spain that, you know, tests sometimes used to show a negative result when it's positive and so on. And so the quality and the stress testing of the quality of the product is quite important. And also speed has been important. And so our view has been very clear to say, with all of these things being equal, so if you were having two suppliers, for example, let's say one white owned and one black owned, and all of these things are equal, then certainly the preference should be given to the BEE supplier, right, in terms of the procurement. That's certainly what we've been driving from a fund perspective. The model in which we work as a fund is that, as I mentioned earlier in the introduction, we were formed as an output and partnership out of government and business, but more so in business. Business came together and created an umbrella body called Business for South Africa, which was specifically set up as a response for COVID. So we're all the business formations, South Africa, together under the Business for South Africa umbrella to effectively pool their resources together, really, to direct them towards, you know, fighting COVID. And so the procurement engine that was built, so in terms of you know, the suppliers, how do you vet them, you know, what products do they have, and all of these guidelines that I speak of happens within that structure. And certainly, Cindy, I can say hand on heart, actually, I've seen a lot of the approvals of, I can safely say that, especially, you know, in the period that I've been in the fund, where a lot of the flow of the, let's call it the orders, is actually starting to be directed to a Black-owned suppliers. Initially, I think that there was a lot of emphasis that was placed on, let's call it level 1, 2, 3, 4, kind of, you know, using that metric, but certainly we've been focusing a lot more on the ownership aspects within that, because we know that for you to have level 1, level 2, level 3, level 4, you know, you're looking at the holistic scorecard. So to your point around entrepreneurship, we've been shifting a lot of that focus to actually focus on Black-owned businesses in terms of where we procure from. And certainly I can say that in the numbers, you know, that I've seen, and I'm sure will be published in our website, is that over the past month and a bit, actually, 97% of the PPEs that we produced have been procured from Black-owned businesses. And I can say that without fear of contradiction, in the context that we've been in those discussions, we've seen those figures. I think, and some of them manufacture or starting to manufacture, catalyze local manufacturing, as I've said, but certainly pendulum has swung, completely into the local.
Administrators to collate some of those questions, and we can send them through to Nomkita's office if she will allow. But I have seen also on your website that you do have a frequently asked questions tab. If your question is there already, please do also refer your questions and just go and check if this question has not yet been answered. Nomkita, thank you so much for coming through today. I know you've got a very, very tough time ahead of you with all the disbursement meetings and all your audit comms and your board meetings. And I know Trafosa is not gonna it's gonna definitely be tough law audit com questions. Asking questions, but we are really grateful for the opportunity to chat to you today. And for the members that are listening and guests, and we call them friends of the AWCA, thank you so much for joining us today. Please make sure that if you want us to have another session that's similar to this, when that trillion rand, even if it's not met as yet, we can always organize with Nomkita and the team to have another session, or we can even ask an opportunity to send through any other comments or ideas. Nomkita did say we need to be innovative. We need to find sustainable ways of doing things. And AWCA is definitely going to be that powerful voice, Nomkita, that is there to support you. You are not alone in this journey. We do believe that there's a lot that still needs to be done. Just know that we are here for you, and we are really, really grateful for the work that you're doing.
Well, thank you so much, Buhle. Thank you, colleagues, and to everybody that has joined. These platforms are important because of exactly, your last words. We could never be doing what we're doing as a Solidarity Fund if it was not about South Africans demonstrating their ability, to come together and showcase unity in action. So we thank you so much. For actually, AWCA has been one of those. In fact, my Makulu was one of the first people who called me to say, think about this now, do this now, and so forth. So very grateful for that, but also very much to the Tumamina spirit that lives in AWCA, where a lot of your members have put up their hand to say, how can we help? Some of them we've co-opted and so on. So we are very, very grateful for that. So thank you very, very much. And let's continue sharing the ideas, because ultimately it's the combined solutions that are going to have the most impact. We don't hold the patent to all the answers. So we'd like to have as much input as we can as well. So thank you for the time.
Thank you so much, Nomkita. Thanks, everybody. Have a good afternoon and evening ahead. Thank you.
Thanks, Buhle.
Bye.